The experience of a surgery can be quite traumatizing, not just physically, but also mentally. You have already been through a lot, and then you must subject yourself to such a drastic intervention. And after that, there's also the recovery period to endure. Mental health is a common complication of a surgery, but it's rarely discussed. Today, we have Renata Weiberti Mendes, a licensed psychologist with extensive experience in the field of mental health, and she's also my little sister, to share with us some insights on how to improve our well being during this difficult period. Any surgery is a drastic intervention that has risks, and a successful outcome isn't guaranteed. Do you have some tips on how to prepare yourself mentally for a major surgery and the long recovery period that follows?
It is indeed a drastic intervention. I like when you say that because it is true. And it is important to acknowledge that it involves significant change, including losses. A loss of how your life is now, how your walking is for now, and luckily a loss of the pain. That is what we hope for, right? So acceptance is the first and most crucial step. Embrace the idea that there will be both negative and positive change. It is essential to prepare yourself mentally for this transformation. So, how it was for you?
Compared to my first ankle surgery, this time was much easier without the trauma of an accident or the need for urgent treatment. Of course, experience and maturity help. Also, I had a lot of time to prepare myself in all aspects. And there was the hope of a new life without pain. But the first weeks after the surgery were tough. I noticed some signs of PTSD along with disorientation, difficulty to concentrate, and other mental effects. Well, possibly due to the anesthesia, the medications, and lack of sleep. And I was in pain and discomfort, bad reading, relying on others for almost everything, and with constant worry about potential complications and the outcome. So, what can be done to restore and maintain your mental and emotional well-being in this difficult initial recovery period?
Mm, uh, there is something we can do, and we can do before the surgery. So let's get back to the pre-operation a little bit. There are some guided meditations that I see bringing some positive effects because they allow patients to envision possible future scenarios, including struggles, seeking help, and dealing with various circumstances. We imagine ourselves in that circumstance and how can I deal with it. So when it happens, it's like, oh, I know it happens. I already envisioned that. So now, regarding to the post-surgery phase, PTSD is common and exploring it is crucial. If nightmares or panic attacks occur, it is important to express and discuss them. It's like putting these symptoms into words helps to symbolize and transform fear into something manageable. So talk about your experience with your therapist, your family, nurses, doctors. The more you communicate, the lighter the burden becomes. And how have you been feeling? And what have you been doing to cope?
Well, I had some ups and downs. At some point, I was often thinking, when I will feel normal again, when this is going to be better. And I try to face those thoughts, but also to distract myself a little, um, like setting some goals, like getting back on my bike, um, and use this free time to learn something new, like using a video editor. I also look for inspiration, connecting to others that were going through the same thing. And I try to focus on self-motivation, my loving family, and adhering to the treatment, having hope. I think it's very important also to recognize that the entire family or caregivers are experiencing specific emotions as well.
Yeah, definitely. Please be patient with your family as well. And I appreciate your mention of finding some distractions and some small pleasures. It is crucial to identify activities that bring joy and light to your day, whether it is playing video games, watching TV series and movies, playing cards with people around you in the bed, or reading books, singing. Allow yourself to find moments of happiness, but also give yourself permission to cry and need it.
Good. So thank you very much for this small chat. And I want to end just mentioning that patients recovering from surgeries may experience these psychological issues which affect their well-being and impact their recovery. So find your own strong support system and search for help and psychological support. Thank you.
Thank you.